Hi, I'm not sure if you have followed Dr. Keith Barrington's blogs. So the website is mentioned here, neonatalresearch.org. I would recommend you go through them and probably follow him on that as well, because you do get a lot of relevant, up-to-date information, analyzing the recent articles and so on. So this topic I have just picked up today because that's one of the areas that I'm interested in as well. And I've been mentioning about the oversupply of meta-analysis. So he has put the title as Beware of Meta-Analysis Factories. In fact, when I met Dr. Gautam Suresh in one of the recent meetings, one of the questions I posed to him was about this. Are we producing too many meta-analysis or systematic reviews? The problem with that is obviously the results may seem striking, and people who are looking at it may actually think it's results of a real study, when actually it's just synthesizing the information that's already present in possibly a different format. So in this article, in this blog, he has summarized why he thinks meta-analysis, too many of them may not be ideal, partly because the studies that are included in them may not be clear-cut relevant, or they may be dodgy, like some of them in the Chinese national database, or they may be just in Chinese language. The other important issue is about the number of meta-analysis that's happening. So the question of whether the studies are relevant, whether they've done it appropriately as well is one. And the pressure in the academic circles to publish or perish. So one of the reasons people do meta-analysis, which is probably more than the actual number of research articles. So he mentions it here as well. He finds more systematic reviews and meta-analysis than the original articles. And there are academics who think it's much easier to just recycle the results of someone else's research than to perform a trial themselves. I fully agree with this, because to do a research project these days is very time consuming, expensive. You need a good setup to do that, and possibly link up with multiple centers. And again, there are many issues. The research may not get completed due to lack of adequate recruitment. He himself quotes, not in this article, but in another blog, the problems he had with this trial on hypertension in premature babies. And obviously, we have to look at selecting the appropriate topics. Dr. Gautam, in the talk that I mentioned, clarified that the reason people don't look at whether the result is going to be meaningful, because there are many systematic reviews which have 0 articles or 1 article or 2, which may not add much meaning to the information we already have. So the reason that happens is because you have to provide your hypothesis first, you have to provide your the way the information is formatted. So here he has mentioned how the journals can look at whether they are